It's really interesting to see the sort of a dichotomy in audiology education in that our field is exploding so rapidly with technology and our scope of practice, yet it's really important to have a very firm foundation, thus the Back to Basics series. I look at audiology as an area of study that's sort of similar to perhaps mathematics or a language where we build, and if we don't have that solid, firm foundation, we are at a disadvantage. I'm a real linear thinker, so as I think methodically about audiology education, I think about, first of all, laying the hearing science foundation, and then I think about moving toward assessment, and then I think about moving toward treatment. Dr. Berlin will be presenting on September 25th, and I know that all of our wonderful lecturers are going to present what they feel they would really like to cover, but we're talking about some areas, for example, with regard to acoustics, with regard to, again, moving from more simple harmonic motion into more complex waveforms, thinking about psychoacoustics, really laying the foundation for clinical audiology, and then also looking at the anatomy and physiology of the ear and getting those basics down before we move forward with diagnostic audiology. Our second person in the series is Dr. Ross Roser, and he'll be presenting, I believe it's the very next week on October 2nd. He'll be talking about calibration, and I know that many of us feel, including myself, that it's something we don't do that often, but how very important. And he's going to be talking about the ANSI standards and how very all-encompassing the calibration process is. And I think that there's a dual part process. It's really important to get the basics down. It's so important with regard to our audiologic testing and really being able to obtain a valid audiogram. The second part to that I see with our students is, of course, the hands-on experience that I think all audiologists should know how to do. And so he'll be providing some basics for how to do that. I'm honored to present, and that's getting into the basic testing, that's getting into audiologic testing, pure tone testing, interpretation of the audiogram. I, of course, see students every day in my position as Director of Audiology Studies at Washington University. And one of the big areas that we find our clinical supervisors are seeing that we need to be fortified is the interpretation of the audiogram, and to really have those skills down pat immediately and not have to think about them. So I'm going to be talking about that area as well as how to obtain a valid audiogram, some of the areas that can really influence our testing. And we're going to be talking about really gaining those clinical insights as opposed to being a technician, how to really become an audiologist and really be able to interpret those findings and then go to the next step with regard to interpretation. Our next presenter is Dr. Lisa Hunter, and she'll be presenting on admittance audiometry. What we have in mind is that we talk about some of the basics, including tympanometry, how to interpret those areas. I love that our field is exploding with new technology, but as I also tell my students, it's so easy now to just push a button and there's a tympanogram. So really, what's behind that measurement that we're obtaining? Dr. Hunter will also be talking about the acoustic reflex, perhaps some multi-frequency tympanometry, some of the research, of course, that is ongoing in all of these areas, and evidence-based practice, how to apply those principles to our daily practice, and then along with the admittance area, some of the areas like acoustic reflex testing and acoustic reflex decay. And then our final presenter is Dr. Christy Yoshinaga Tano, and we're going to take a lot of this information that we've talked about with regard to assessment, and we'll talk about how to adapt it for the pediatric population. So we're very, very excited about talking about early identification of children who might be deaf or hard of hearing, and then also looking at early intervention and looking at amplification, cochlear implants, parent-infant programs, and the educational process. So those are all tall orders to fill within an hour, but we're going to do our best.